Hi, our presentation slides are a little bit changed ever since we the agenda set out. I'm Jihyun Shin from New York City Center for Economic Opportunity. I'll talk to you about two new research projects in New York City and related method. The first one is imputing medical out-of-pocket expenditure into ACS. And the second one is estimating legal status for non-citizens. Then I'm going to briefly talk to you about how New York City uses alternative poverty measure for policy purpose. So we've been thinking about measuring the impact of Affordable Care Act on New York City's residents' economic securities. But data are not available yet for those years in which ACA went into its full effect. So today I'm going to just mostly talk about technical improvement we have made so far. So these are the questions that we set out to tackle in near future. Basically, our question is ACA affordable for low-income families in New York City? How does it affect poverty status? And the focus will also be on whether and how New Yorkers changes their allocation, resource allocation in response to ACA. So let me briefly talk to you about the CEO's original approach to MOOP. For our alternative poverty measure, MOOP is subtracted from the family's resources. We use medical expenditure panel survey data, which has several advantages over other survey data. The biggest two advantage I could think of is, first of all, it captures the dynamics of health insurance and its relationships to health care expenditure. But more importantly, it measures MOOP with a greater accuracy because it uses medical provider component data to verify the household information on their spending. Old method imputes the MOOP lump sum value to ACS relying on predictive mean matching method, which is combined with hot tag approach. Imputation was done at the poverty unit level, and we think that there is a room for us to make a little bit better. So these are the key things that we consider in improving our method. We want it to be a little bit flexible enough to preserve the key data features like zero mess in the data set. And of course, it has to preserve the distribution of MOOP known from the MEPS and reproducing covariance structures. We wanted to use a little bit, method that it's a little bit easy to implement and justify to non-statistician. Since each data method changes could change our data series, and we have to speak this in a meaningful, useful way with other people. So how did we do? Basically, we kept the backbone of our approach. But here are the few things that are, noteworthy. First of all, we separate the premium portion from the medical spending. We created a health insurance unit in ACS. Remember, original approach summed up the MOOP value at the poverty unit level, but now we're using much smaller and precise unit. But our medical spending is imputed at the individual level. This is because seeking a medical care service is fundamentally a function of person's, medical needs, given coverage benefits and income. And we also improved our regression and allocation matrices to include more important predictors that has been omitted in the previous method. I'm not going to get into the details. For Medicare coverage, we improved the premium estimations to reflect on New York City's distribution using the data from the Center for Medicare and Medicaid Services. I'm gonna skip this part and we'll come back to it if time allows. Here's the results from this table compares the poverty rate and then imputed MOOP values using old and new method. The very first column is what we published in last spring, April, and the second column is presenting the result from the new method. Our new method actually resulted in reduction in the city's total MOOP value, about $1 billion less than what we published in last spring. This is achieved basically by better matching routines and preserving the zero mess, the share of zero values. And then now the total MOOP value is estimated to be $8 billion, and 72% of it is actually premium portion. Obviously, our new method actually affected the total SNAP value as well, which is imputed to ACS, matched with the administrative data. This is because for SNAP eligibility, we account for excess medical spending for elderly and disabled, which is now about $1 billion less. So this is our next steps in improving MOOP imputation. Our exploratory analysis suggests that Medicare Part C and D penetration rate is different across the New York City's 5 boroughs. So the current method does not consider the geographic differences yet, so this has got to change. And we're exploring the city-level data that could tell us about the city residents' behavior around the healthcare system, and so that we can accordingly calibrate our method. So another innovative work of a CEO in poverty measurement is that we estimate the legal status of non-citizens. So let me tell you briefly about how the immigrant poverty come into focus for us. This graph shows very troublesome spiking poverty rate for the non-citizen for the past years. The rate at which increase happened was much more dramatic than any other subgroups. So this raised the questions about who they are, where they live, and what we can do about them. So in this chart, the red wedge represents the non-citizens. It includes unauthorized immigrants along with green card holder and refugees, asylees, non-immigrants, and quasi-illegal immigrants. This information is not available in ACS, so how did we assign the legal status? We use the logical method pioneered by Jeff Purcell. It begins with a non-citizen population and identify legal residents based on their response. For example, if someone says that I am a policeman, then we assume that this person has a good chance to, that this person could be legal. And then we controlled for expected population based on country of origin. And then finally, we adjust for undercount of those undocumented in the ACS. The last part is where we, often get into trouble with Donald Trump. And this is specifically why he's keeps saying that, the number of 20 millions instead of 11 millions. So here is what we found about unauthorized immigrants in New York City. There are almost 560,000 people in New York City. The red bar is unauthorized immigrants, and the blue bar is total New York City. This chart is comparing their characteristics. So the unauthorized immigrants are they have more males and working age individuals, and the share of people living in a family with 3 or more workers much higher and larger for the undocumented immigrants. Unauthorized immigrants are less likely to be educated, and then they are more likely to have limited English proficiency, and they have less access to the health insurance coverage, and they are likely to living in overcrowded household. So here is, this graph shows poverty rates without the legal status is identified, the first 2 bar chart, and the poverty rate by immigrant status. So with the legal status variable, I'm not sure if it's working, the city's poverty rate is estimated to be 0.4 percentage point higher than what we published in last spring. This is because by definition, they are those people who are living, receiving minimum level of benefits. So in other words, we do not assign EITC to them. So this increased their poverty rate, seems like, but it's the difference between these is not statistically significant. And about 35% of cities' unauthorized immigrants are living in poverty. So I'm going to talk to you about how New York City is using the alternative poverty measure for the policy purpose. CEO poverty measure basically serves as a tool for policy development and evaluation. The mayoral campaign often cites the poverty rate or poverty or near poverty rate of 46% as a key agenda item. All programs now need to review the effect on inequity using the poverty lens with regard to program outreach and outcome. So here are the recent efforts by the Mayor de Blasio in incorporating research into policy. What we learned from our research is that wage is important and also the housing support matters. So first example, our minimum wage simulations showed that a significant number of people could have escaped poverty with increase of in the minimum wage. So the mayor called to increase the minimum wage to $15 by 2018. And our second work, for example, has shown how the important housing supports are for economic security of cities' poor population. So the mayor has a goal of providing 200,000 affordable housing units in the next 10 years. He will get to this number by not only building new units, but also preserving what we have. By protecting rent regulation and also providing legal assistance to tenants facing harassment from rent-regulated apartment. So what's next? So we will continue to improve our MOOP methodology and calibrate it to reflect the New York City's residents' behavior or New York City's distribution if possible. And we have immigrant poverty report coming up soon. We're currently working with the Mayor's Office of Immigrant Affairs. They're calling it a immigrant inclusion and call for action, which will include poverty data and their MOIA's lengthy policy response. We're also working with numerous agencies and task forces as a data resource and in research collaboration. do I have a time? About them?
Sure, at least 10 seconds.
Okay, so what I didn't cover in this presentation is our recent methodological improvement to how we estimate the rent market rent for the rent subsidized residents. So we're using fixed and random effect model, and we reduced the prediction error greatly, so we're so proud. So if anyone want to know how we did, just come and talk to me. Thank you.